Week 8 musculoskeletal and neurological assessment. This is our patient, Justin. I'm Ronda McKinney. I would come into the room, wash my hands, shut the door, provide privacy. I'm going to have Justin walk as if he were walking in the room so that I can observe his gait, okay? So Justin, if you could just walk forward and then turn around and walk back. And his gait is rhythmic. He doesn't appear to be limping or listing to one leg or the other. Now what I would like you to do is walk that same distance, toe heel, toe heel. And then come back. And we can see that his balance is very good. He's not stumbling or attempting to fall. Now, just relax your arms down by your side and close your eyes. And I want you to just stand there with your eyes closed for a moment. This is the Romberg test. And he isn't moving or losing his balance. So his Romberg test is negative. Very good. Now, if you would just have a seat up here, please. Now, just take your finger to your nose like this. Good. Now take your right hand and touch my finger. And your left. Very good. All right. We're going to proceed now to the head and neck. So what I'm going to do is palpate your joint, temporomandibular joint. You tell me if you have any tenderness. I don't detect any swelling or heat. Now open and close your mouth. There's a couple more times. There's no crepitus noted. Now open your mouth partially. And I can see that his teeth are about 2 to 3 centimeters apart, which is where they should be. Now open your mouth as wide as you can. Take your lower jaw and move it toward me. Now move it to the left and right. Okay? Now move it against resistance. Without turning your head, just your jaw. Good. All right. So you have good resistance. There is no unequal movement or muscular strength in his face. Now, I want you to clench and unclench your teeth. Do you experience any pain with that?
Nope.
Okay, good. So again, the joints and the muscles here in his face and jaw are intact, and there is no swelling, no tenderness noted, and he has good movement right to left, as well as opening and closing his mouth, which tells me his teeth are probably in alignment as well, which is good for chewing. Now I'm just going to untie your gown, okay? And I'm going to look at your cervical spine. And I'm going to palpate your muscles. And your spinous processes, which are straight. I do not detect any nodules. Is there any tenderness when I palpate any of these muscles?
Nope.
Okay. No on the trapezius or anything?
Nope.
Okay. All right, what I would like to do now is test your range of motion in your neck, okay? So, as you look at me, I want you to bend your head forward as far as you can. Good, and I want you to then bend all the way back and look at the ceiling as far as you can. Good. Now I want you to take your ear to each shoulder, side to side. Good. Now, I'm going to want you to try that again to turn your head against my resistance. Good. And now turn and look. There's equal movement bilaterally in his neck. His neck is erect into the midline. There's no tenderness here in the muscles. The spinous processes are in alignment down his back. So next we're going to move on to your shoulder. So I'm just going to take the gown down. Is that okay?
Yep.
Okay, now I want you to relax your arms and shrug your shoulders. Push against my hands. Good. Now, do you have any tenderness as I palpate across your shoulders?
Nope.
Beginning at the clavicular line.
Nope.
Down here.
Nope.
And I'm just going to palpate the scapula, okay?
Okay.
Both sides. There is a bilateral position of his scapula. No tenderness.
Nope.
There, I feel no heat, no nodules. There's no redness to his skin. So now we're going to test your range of motion, okay? If you could stand up for me off the giant table. All right. Now, I want you to, I'm not going to apply any resistance, okay? I'm just going to feel your shoulder joints as you move your arms. I would like you to raise your arms with your fingers pointed to the ceiling. Now take them down in front of you and raise them back up. Any pain?
Nope.
Okay. Now raise them to the back, hyperextend them as far as you can. And down and back toward me from this position.
Nope. Gotcha.
Yeah. Any pain?
Nope.
Okay, and I feel no crepitus in his joints with any of those movements. And as I look at his cervical spine from the side, I can see that this is concave and this is convex and this is concave exactly as it should be. Since, not that you're old at all, you're very young, but if I was going to check for scoliosis perhaps, I would notice that there might be one shoulder higher than the other. The scapula would be higher than the other. I would not see this line, imaginary line that he has down his back, and probably his iliac crest would be uneven. One would be tilted higher than the other, and you perhaps could see a slight curve here in the spine if scoliosis were bad enough to note so. However, he has none of that. He has symmetry in the shoulders. Cervical spine is erect. It's in the midline. His head is in an erect position, and there is a line down his back. His hips are even. His feet are even with his trunk. He has good support in his body. Okay? If you'll turn back around and be the movie star now. Now we're going to do a couple, well, you may want to turn back around, or at least to the side. What I would want you to do is take your hands, internally rotate your hands, and try to touch your shoulder blades. Okay, good. Now I want you to let your arms dangle, bring them up, and place your fingers behind your head. Any pain with those movements?
Nope.
Okay. As you can see, he has ease of movement as he moves through these, which, again, he's young, and so his joints are not stiff, nor do I detect, as I look at any of his joints, any swelling or deformities or nodules noted. So far, so good. Okay, now we're going to do this little exercise. I want you to raise your hands above your head and put your palms together. Bring down one arm at a time and sweep it across your body as you do. Do you feel any pain when you in your shoulder when you sweep across?
No.
No, good. So again, normal range of motion in his upper extremities. Okay, good. Let's see if we can put you back up here on the table. I'm going to take a look at your wrist and hands. All right. As I look at his wrist, I notice that his hands extend perfectly the way that they should. His fingers are neither flexed or hyperextended. You tell me if you have any pain. I feel no nodules or deformities in the knuckles or in the phalanges. His skin is warm. There are no lesions, no redness. Okay, let me just look at your palms for a minute. Okay, he has a good brown pad here at his thumb. Okay, now just put your hands out like this. Now, I want you to put your fingers toward the ceiling and down to the floor and back at the midline. Now I want you to do that with just your fingers. Fingers up and fingers down. Good. Now take your wrist and you're going to move the wrist in and you're going to move the wrist out. In and out. Do you have any pain with any of those movements?
Nope.
Good. So what we're seeing here is great ease of movement and pretty much a normal assessment, which is great. However, should we note that he has any crepitus or pain with any of these movements, of course we would need to test further. In the older adult, we might see nodules here on the knuckles that could be indicative of arthritis of some kind and would impede the movement of the hands. Now, hold your hands up like this and just make a fist. Make a fist. Okay, good. Now, I'm going to support your arm. Just relax it on me and turn your hand up. Now, I'm going to try to pull your wrist back and I want you to resist me. All right. Good. Does fine against resistance. He has normal strength in both wrists. Now, do you have any pain in your hips at all?
Nope.
All right, let's lie you down. Are we doing okay on time? All right, now I'm just going to feel your hips, okay? The hips seem to be in alignment. His legs are in alignment with his hips and the trunk of his body, and his feet are in natural alignment with the kneecap and the bottom of his leg. The feet are not falling out or coming in. Now, what I'm going to ask you to do is take your leg and raise it up to the ceiling, keeping your knees straight. And back down. And again. And back down. All right, now I want you to bring this knee into your chest. And I'm just going to put my hand here to see, and I'll help you, I'll support your leg, but I won't help you move it. I want to see if you have any creaking or crepitus in the joint. Oh, you kind of do. You sure did. I do feel some crepitus in this joint. Good. Let's try this one. And I'm not helping him move. He's doing all that on his own. Okay, now I'm going to push down on your feet, and I want you to push against my hands. Good. Now push against my hands. Good. Now, if you could put your foot up, just bend your leg. I want you to, with your hip, lean your knee to the left and then to the right. Any pain at all in this hip? Okay, good. Let's try it on the other leg. A normal range of motion. Now, straighten this leg straight up to the ceiling again and bring it to the right and to the left. Good. This leg. Good. So, he can move through all the range of motions pretty easily. Little crepitus noted in the knee. We will take a short break at this time and pick this up and finish the musculoskeletal exam shortly.